Mackenzie.
I'm Grace.
And I'm Lainey. And this is our wheelchair exam. So we're just going to start off with naming the parts of the wheelchair. So we have the footrest, leg rest, front rigging, the seat, the frame, and the middle skirt.
And then we also have the armrest, the hand grips, the rear wheel, the backrest, the push axle, and the hand grips.
And then we have the brake, the caster wheels, the crossbars, the tipping levers, and then the anti-tip caster, which would normally be around here. So now we're going to show how to remove the leg rest and the armrest. So to remove the leg rest, there's a little lever that you'll push inward and swing it out, and you'll pull up the leg rest. And to put it back in, there's two little screws that you'll fit into the holes and then just lock it back. And to remove the armrest, there is a little clip at the front that you'll just push down and pull up. And to put it back in, you just push down and lock it in. So now I'm going to demonstrate how to use a gait belt. My patient is already here with their wheelchair locked, so they won't roll away. Now I'm going to take the gait belt, set up with the teeth, and wrap it around their waist. Feed it through this part with the teeth, and make sure it's not too tight. And then feed it through the other loop. Make sure it's not too tight. Make sure it's like a 2-finger width, not width, gap, space, gap, and then just loop it in. So today we're going to be transferring a patient from the wheelchair to the bench using the stand and pivot method. First I'm going to check the brakes to make sure the patient doesn't move. And then I'm going to pick up their leg, drop it between, push out the leg rest, pick up the other leg, drop it out here, and push up the leg rest. Okay, and then I'm going to have them put their feet together. I'm going to put my feet on the outside of their legs. And then on 3, we're going to rock 1, 2, 3. And then on 3, we're going to pivot and sit on the bench. Okay? Ready? 1, 2, 3.
Okay, so today we are going to be demonstrating how to transfer a patient from a bench to their wheelchair using the squat pivot. So our wheelchair is locked, and we have our leg rest pushed out so that the patient can easily move into the wheelchair without any hassles. And we have moved up the closest armrest. So I'm going to put one leg in between theirs and the other on the outside. And on the count of 3, we're going to rock forward and then easily move into the wheelchair. So 1, 2, 3. And now I will lift up this leg, that back. Today we will be demonstrating how to safely go down a ramp. And first we will unlock the brakes. And for extra safety precautions, the patient is already wearing a gait belt. And now that we have unlocked the brakes, we have to have a steady or a firm grip. And we will steadily go down the ramp slowly at our good pace so that the wheelchair and the patient do not get ahead of us.
Since I don't have ramp access, I'm going to pull my patient down a curb. Now I'm going to warn my patient beforehand that she's going down a curb. I'm going to turn her around, and we're going to use the one wheel method. To pull her to the curb, I'm going to place my leg right here, and then pull her back, and gently set her down.
Okay, because there's no ramp, we're gonna take the patient up the curb. So we're gonna turn the patient so their back is to the curb. We're gonna back up to the curb. We're gonna let the patient know that we're about to pull them up the curb, and we're gonna lean them back, and we're gonna tip them back. And then we're gonna pull. And then we're gonna set them down gently.
So we have the patient in the wheelchair with the gate belt on, and I've unlocked the brakes so that we can easily move up the ramp. And to safely move up the ramp, we are going to have a firm grip on the wheelchair grip handles, and we will brace ourselves as we go up the ramp so that neither me or the patient fall backwards. And here we go. Okay, so to demonstrate going into an elevator, and we'll also demonstrate coming out of an elevator safely. Now, since these elevators are not in a hospital, they are quicker than typical like rehab setting hospitals. So we will back up and go in. And we will also go to the second floor. And now we will demonstrate taking our patient off the elevator, and we will also move backwards while we're exiting and let them know that there may be a slight bump. Alright, so be careful, there might be a slight bump coming off. And we will wait till we have a clearance and turn them back around facing forward.